Hi everybody, Morty Lax here at SeniorCare EMS, coming to talk to you about a training subject. Typically, when I do these training videos, I like to have something tactile, something to show you, something to practice with, to teach you a new skill, refresh you on an old one. Today, I think that it's important to spend some time talking about a difficult topic. We're going to encounter difficult calls out there, difficult situations, sometimes even difficult patients. Let's talk about this. It's time to have this conversation. I've posted internally here at SeniorCare over recent weeks. There are several pieces that I've written. I've commented about certain cases or incidents that have taken place in the news. EMS crews getting arrested. This kind of thing should never happen. While we might be placed in difficult situations, it's up to us to impact this call properly. We're supposed to be the voice of reason. We were sent there to help people. We're supposed to be empathetic. Empathy means trying to identify with the situation your patient's in. Try and feel what they're going through. It's about doing the right thing by people. And that's really the most important message here, regardless of everything else I'm going to say, as much as there are some useful tidbits. Do the right thing. All right. So a couple cases that were in the news recently resulted in EMTs losing their jobs, EMTs getting arrested, charges brought against them, murder charges. It's a pretty big deal. I think that when it comes to dealing with difficult situations, we have to remember that our responsibility is to care for these patients. There's typically something underlying. Whether it's a psychiatric issue, whether it's a medical condition that's causing a alteration of a patient's mental status that might seem like it's something else, whether it was drug abuse, whatever it is, it really doesn't matter. It's our responsibility to try and get to that root cause and treat it. Empathy. I'm going to keep saying it. You have to feel for your patients. That's why you got into this. And if you can't remember that, it might be time to reconsider. So what can we do in some of these difficult situations? So empathy is number one. The other two phrases I'd like to mention, one is one to never use and one to always use. The one to never use is, you guessed it, two words, calm down. Telling somebody to calm down in a heated situation raises that temperature even more. I'm sure you're thinking about it right now. We've all done it at some point. It does not get people to calm down. Don't tell me to calm down, right? That's usually the response. Or I am calm. Clearly you're not. And my telling you to calm down is not going to get you any calmer. Instead, try to practice something called reflective listening. Listen to the patient and show them that you are listening. How can you indicate to them that you're listening? Very simple phrase. Well, let me see if I understand you correctly. Use the right body language, use the right tone. Patients will have this sense that you care, that you're interested in what's going on, that you want to help them. It's about people. Empathize. Always do the right thing. Stay safe out there.